much, Prof. Alam, for publishing my paper recently. Education program for nutrition and dietetics in comparison to Arab and African countries. Sudan has basic and further education programs for nutrition and dietetics. National standards for education programs, no unified national standards in relation to the course content, examinations, student assessment, or supervised practical placement. And maybe Dr. Badr, now this is your job. With regards to national dietetic organizations, we are looking for Sudan Dietetic Association to accredit dietitians. Nationally, there is no available in Sudan at present. In Sudan, doctors versus populations ratio is well known and is being reported to be nearer to international benchmarks, so they're doing fine with regards to the medical profession. However, for the, and this how they were doing, that's according to the EMRO report in 2013. However, this is not the case for dietetics, which might result in a skill mix inequality. The number of dietitians working in clinical and non-clinical areas is well known in Sudan, and many are working outside Sudan, as Dr. Mentioned. So it's one of the profession, we can say that like in Saudi Arabia, for example, if we take it as an example, Sudanese professional of dietetics, they established many great programs in Saudi Arabia. It is important to review the whole system of nutrition and dietetics in Sudan. This is in order to raise awareness of the standards of education and training, which also helps to emphasize the profession of dietetics in Sudan. The review, the target of the audience for this review is the situation of professionalism and dietetic practice in Sudan, and may be bonded by discussing the wider implications for other African or Arab countries. The clinical relevance is to promote the profession, the work and the practice in Sudan. We need greater understanding of the profession and related dietetic practices. It is also a call for dietetic professionals inside or outside Sudan to use their skills and resources to promote the profession, the work and the practice for dietitians, and to avoid shortage of qualified dietitians. It also a call for greater understanding of the profession and the related practices through reviews and surveys. Professionalism for the field of dietetics, the term professional conduct is being organized to incorporate professionalism. And the International Confederation for Dietetic Associations, they defined the dietitian as the person with legally recognized qualification who applies the science of nutrition to the feeding and education of groups of people and individuals in nutrition and disease. As a profession, dietetics has established standards for practitioner education through different international associations, such as the American Dietetic Association, Australian, and the Canadian one. And in 2004, the International Confederation suggested a bachelor degree with a minimum level of education or basic education as a bachelor degree, and in combination with an internship or practical practice for at least 500 hours with under the supervision of a professional person. Dietitians are independent practitioners who work within an ethical framework. They have their own code of ethics. Dietetic associations are aiming to support their members with their education and profession. Quality and performance scope standards is very important with the profession. Dietetic profession involves in different practices such as growth, assessment of nutrition status, and management of nutrition-related diseases. Areas of practice also is various, include management, medical, community, and nutrition and instructions. The purpose of this review was to examine the available evidence and present the most current research for the profession of dietetics in Sudan. The other aim is to review the history of the development of the field of dietetics over time, and to define and specify professional skills for dietetic practitioners, and finally to assess the scope of dietetic practices for dietitians in the country of Sudan. The methods and designs used, the targeted research was, we used 6 electronic databases, including ISI, Midline, PubMed, Embase, and PsychoInfo, up to April 2015. The search for the first, the review is for 2 parts. The first part is for professionalism, and we use these terms. The second part is with the dietetic practice, and we use these terms. The reference lists of published works were also searched for additional sources. The search included mesh and text word terms with combination with using operator. Electronic theses online, they were also used or searched, discussion papers, governmental reports, expert opinions, personal contact and communications with experts in Sudan with also approached. Inclusion, including all articles, reviews, service evaluation, practice, populations, interventions, they were all included. We didn't exclude anything, we included everything, just to try to find any information. Topics of interest, as we said, were professionalism and dietetic practice. Okay, now I'll move on to the results and discussion. The basic education in nutrition, based on the International Confederation of Dietetic Associations, basic education, as we said, in nutrition and dietetics leads to bachelor degree, and academic courses leading to a major diploma. However, in Sudanese universities, such as Ahfad University, for women, a degree-level education program is offered, and actual time taken is from 3 years to 4 years and a half. This from the website of Ahfad University, and also we tried to approach many experts in Ahfad, like Dr. Sadiqa Washi. However, as you mentioned, we didn't find much information on the websites for universities, and also the response was very slow. University of Khartoum, under the program is given under the Faculty of Education, Department of Family Science, under the name of Nutrition and Dietetics. Okay, the number of graduates in the period from 1999 to 2015 was more than 1,000 students, and as I said, the program was established since 1966. And this information was from the University of Khartoum, from one of the academic staff at Community or Epidemiological College. We found that this information is being sent to us as a hard copy and I tried my best to translate it and to find any information. With regards to the University of Ahfad, or Ahfad University, food and nutrition program is under the School of Health Science. The actual time taken to receive the degree is 5 years, and again is established at the same time in 1966. Recently, at Rabat National University, they had programs, and they had 2 batches. Okay, and the total of graduates were 140. And again, one of the very famous staff, she works with us in Taiba University, and I tried to approach her also to get some information about, or more information about the ribat, but again, I failed to. National dietetic associations have been searching standards to accredit dietitians. In 2008, 25 members for the International Dietetic Associations, they reported having national dietetic associations. And this is the report. In Sudan, dietetic students is registered nationwide, and most of graduates are practicing the profession in either governmental or private sectors. Registration is provided by the Sudanese National Council for Medical Health Professionals, which is considered the authorized professional organization for the full registration for all health professionals, including dietitians. This is incomparable with the situation in other Arab countries such as Saudi Arabia. For example, however, I mean, we have the same situation. Like in Saudi Arabia, we are also registered with the Saudi Council for Health Specialists. And we do have, the only difference that we do have dietetic association, but again, dietitians, when we've done this research last year, me and Dr. Khalifa, we found that dietitians, they are not even aware of the dietetic association, Saudi Dietetic Association, if it existed or not. So they are, what I mean, if they're not doing their job up to the moment, they are not activated. Studies looking at dietetics in Africa reported the presentation for fewer dietetics organizations, including Sudan. Reports in 1985 and 1991 by the East Central Southern Food and Nutrition didn't define well the role of the dietitian, which is not understood in Africa in general. Also, the dietitians and nutritionists are possibly regarded as being the same. And to our knowledge, no national dietetic association is available in Sudan to guide the profession. This was with the review. I confirmed that a month ago when I was in Toronto. I met the president of the general secretary of the International Dietetic Association, a dietitian of Canada, and she confirmed to me that Sudan, it is very strange that Sudan, they were registered with the International Confederation of Dietetic Associations in 2004, because I found some data about them and their review in 2004, and I thought that by mistake they did include Sudan in their review in 2008. However, she confirmed to me that they were member till 2004 or 2005, and then they didn't become any members anymore. And I asked why. She said one of the reasons that miscontact, and the other thing is the non-payment. They didn't pay for the membership, and it was very, very cheap. So, and I don't think because of the money-wise, but I think because of the ignorance and for those all professionals being outside Sudan. Establishing a national dietetic in Sudan could enhance the profession in a health field such as dietetics. It needs to be supported by strong work, maybe like your institute, Dr. Badr. It also could support leadership skills and strengthening of the human resource. It is clear that there is a need to develop a unified teaching and education programs. Looking at the number of working and practicing dietitians in Khartoum, the state public hospitals are about 48 hospitals. In these hospitals, 31 has nutritionists who are basically working under food service department and responsible to provide meals for patients. 7 hospitals provide health education and counseling for patients. However, no food services are provided. The other 10 hospitals do not provide any type of nutrition services for patients. Moreover, there is about 500 health centers under the State Ministry of Health plan, and only 21 of these health centers employing nutritionists, and the information was gathered through Dr. Abdullah from University of Khartoum. Sudan is considered within the critical shortage zone for health professionals in general, according to WHO benchmark of 2.28 per 1,000 population. This is included as a ratio of 1.2 health professionals per 1,000 populations. However, doctors versus population ratio is closer to the international level. So they are doing fine with regards to medical doctors, but not with the other health professions such as dietetics. The International Confederation 2004 reported that the number of practicing dietitians per 100,000 population in Sudan, and that was between 1 and 2. Most of the practitioners are working in either governmental or private sectors. The development of effective strategies for improving health services was recommended by the WHO for the number of countries, including Sudan. The strategy is inclusive, shifting from long-established concept of training and health workforce members to wider continuum of RH. The strategies was developed by the General Directorate of Human Resources for Horse Development, and this is the report. And the strategy proposed health strategies plan for Sudan has considered the importance of developing the health professions, including dietetics. And it's a call for, they called for experts' participation in the development, particularly for diaspora of Sudanese physicians and health professionals. Therefore, this review confirmed the need to include diasporas of Sudanese professionals in the field of nutrition and dietetics. The call is to include those who have experience in academic and clinical practice. And the professionals can participate effectively in supporting the development of professionalism, and consequently will give us a green light in helping to help and support the effort to address dietetics in Sudan. In 2013, the National Council for Medical Profession has adopted new strategies concerning adapting the profession of dietetics. This was in collaboration with the Ministry of Higher Education. The strategy published new guidelines for practice as an attempt to improve educational programs and practice in the field. And this is the hard copy of it. Again, we receive it from University of Khartoum. To conclude, there is a lack, as we said, of significant previous research on professionalism and practice in Sudan. Based on the results of the review, there is a need to have information about dietetics, as you say, the database to be posted online. This could stimulate new research agendas in the areas of professionalism and sustainable dietetics practice in the area. Surveys is really needed. This review is an attempt to define professional needs for the profession of dietetics and a critical core for professionalism in the field of nutrition and dietetics, as to assemble a group together and to really help this profession. Because as I said, that they established many great programs in other areas, like in Saudi Arabia and other Gulf countries. So please help this profession in Sudan. The first nutrition and dietetics related schools in Sudan established, as we see, that was 1966. So where are we now, if we are in 2015? This could confirm the role of Sudanese dietetic professionals inside and outside Sudan to help in establishing a national dietetic association, which will help in informing, practicing, representing, and supporting the dietetics members. Moreover, Nutrition Dietetic Association will facilitate dietitians engagement in continuing professional development throughout their careers, and to ensure that their practice is strong, efficient, and advanced. As we said, and as Dr. Badr said, that there is a great chance for all diaspora in different geographical areas. This consequently will help in supporting future efforts to fix the skills gap and address dietetic force in Sudan. Acknowledgement to the, I acknowledge the grateful to, many thanks to Dr. Asma Abdullah from Community Medicine Department, Faculty of Medicine. Without her, I really couldn't gather all this information, most of it. Special thanks also to Prof. Siddiqa Washi, which also contributed in some information with regards to University of Ahfad. Special thanks to Dr. Nahla Khalifa. The idea for this review emerged from the suggestion and discussion made with her assistant, who's here as the assistant prof in our department. This is my references, and thank you for your listening.